Hi, good morning, everybody. As Francesca said, we will be recording this. If you have questions, feel free to enter them into the chat and we will answer as many as we can during the presentation. We'll also be holding a Q&A session at the end of the training, so we'll be happy to spend a little more time on any questions that you may have at that time. So I'm going to share my screen. Okay, so as Francesca said, this is the Housing Link System Overview training. And my name is Stephanie Bowman. I am with the County Department of Housing and Community Development. My department is the COC lead, HMIS lead, and collaborative applicant for Bucks County. So our COC is called the Housing Link. So I'll be referring to our COC as the Housing Link throughout the presentation. So as the Housing Link, we have several components as part of the homeless service system. So there's a coordinated entry system, which is the one-stop access for families and individuals in Bucks County that are experiencing homelessness or at risk of becoming homeless. We have dedicated street outreach teams to work that work with those experiencing homelessness throughout Bucks County, housing locators to help identify housing, Code Blue shelters during the winter months, housing planning staff dedicated to working with those that are at risk and imminent risk of becoming homeless, housing focused emergency shelter services, eviction prevention to keep people in their current housing, as well as housing programs for those experiencing homelessness, including rapid, transitional, and permanent supportive housing. So we'll be talking about all of these components throughout the presentation. These are just some of our Housing Link partners. So the Housing Link really is a collaborative amongst many, many different agencies throughout Bucks County that are all dedicated to working with households at risk of and experiencing homelessness. So a couple of our partners are listed here, but we really do partner with, a large variety throughout the county to make, to really serve clients depending on their needs. For services through the Housing Link system, we go by the HUD definition of homelessness. So I know there's a couple different definitions at the federal level. So we go by HUDs. The majority of the funding through Housing Link is through HUD. So we do stick to their definitions of homelessness for eligibility purposes. So when we talk about somebody being literally homeless, we're talking about them sleeping in a place not meant for human habitation, which can include a car, tent, abandoned building, shed, bus station, etc. Really any place that doesn't have running water is considered not fit for human habitation. So somebody living in a camper without running water would be considered not fit for human habitation, condemned buildings, things like that. Also people that are residing in emergency shelter, residing in a hotel motel paid for by a charitable organization or government program. So that could be another nonprofit or another government entity like Children and Youth would be considered homeless for a hotel. If somebody is self-paying in a hotel, they are not considered literally homeless. The other group that could be considered literally homeless is people that are exiting an institution, such as the jail, where they were homeless prior to entry. They've been in the jail for less than 90 days and are exiting to homelessness. So just to keep that in mind, if somebody's been in prison for a year, even if they were homeless prior to that, they wouldn't be considered homeless, at the end of that, since of their length of stay in that institution. Category 2, imminent risk of homelessness. So we're looking at this category when we're looking at housing planning services. So those that are going to lose their housing within 14 days and have not identified another residents to stay in. Category 4 is fleeing domestic violence or human trafficking. We also use the HUD at-risk definition. So at-risk is somebody who will lose their housing within 30 days. So we also use that definition when we're talking about housing planning services that we'll talk about a little later. I just wanted to note for this that, a lot of times other definitions will include households that are, doubled up or couch surfing. Unfortunately, under the HUD definition, those individuals aren't considered literally homeless, even though, they don't have a permanent residence of their own under the HUD definitions, which is what we have to follow. They aren't considered literally homeless for housing programs. So we're going to talk first about the coordinated entry system. So this is the Housing Link helpline. The Housing Link helpline number is at the bottom of the PowerPoint here. So when you call the Housing Link helpline, they will, complete a brief screening of the house, will determine housing status and appropriate next steps, and then they'll provide referrals and information as appropriate. So if the household that's calling is unsheltered, they would refer them directly to street outreach to conduct verification and support. If they are at risk or imminent risk, they refer them to housing planning or prevention based on the situation. And then households that are fleeing domestic violence or human trafficking are offered shelter wait lists, referrals, and other appropriate referrals based on their situation. For street outreach, we do have 3 street outreach teams that we'll talk about. They are dedicated to individuals or families that are literally homeless in a place not meant for human habitation. So when the referral comes through the Housing Link for a household experiencing literal homelessness on the street, street outreach will contact them and conduct face-to-face verification to confirm what their housing status is, make appropriate referrals to programs and services based on their needs, and provide ongoing engagement and support as needed and requested by the household. We do have 3 street outreach teams that we'll talk about. The first one is through Bucks County Opportunity Council. This is a team comprised of 3 staff that cover the entire county, and they serve all individuals and families experiencing homelessness. Valley Youth House Synergy Project is dedicated to households and individuals that are under the age of 24, so 24 and under. So they are focused on youth households throughout Bucks County, and they have 2 street outreach staff that cover the entire geographical area of the county. And then our third is through Pendle Mental Health Center, the PATH program. They also serve the entire county, and they are designed to work with individuals that have significant mental health or co-occurring disorders. And they have up to 3 staff dedicated to the PATH project. We also listed their contacts here. All referrals should go through the Housing Link. But if you have a client that's actively working with one of these programs already, the contact information is there. Emergency shelter services. So Bucks County technically has 4 year-round emergency shelters. The Bucks County Emergency Homeless Shelter ran through Family Service Association of Bucks County is technically the only shelter that serves all households and families. The other 3 are specialized based on population. So the Bucks County Emergency Homeless Shelter is located in Lower Bucks area, and they can serve families with children as well as individual males and females. It is, they do only have 79 beds, so it's limited, and there's typically always a wait list at this point based on the need going through the system. So they will prioritize based on need of the household coming through. The Valley Youth House Youth Shelter is dedicated to working with youth age 17 and under. So it's primarily runaway and homeless youth. There is a time limit of how long they can be in that shelter. And the goal really is reunification with the family or placement into other appropriate housing based on the situation. A Woman's Place Domestic Violence Shelter is dedicated to working with individuals and families that are actively fleeing domestic violence. And then the Haven House shelter ran through YWCA of Bucks County is dedicated to serving victims of human trafficking specifically. There's also a couple of seasonal Code Blue shelters. These are only operating during the winter months between, for two of them, it's between December and March. And then for the Upper Bucks Code Blue, it is through mid-November through mid-April. So these are not open every night during the winter. They're only open when the temperature hits below 26 degrees. Each of these shelters will make a determination based on the forecast and announce if they will be opening through their websites and or social media. So we have links in the presentation here to their sites where they will post if the shelter will be opening. It is also based on volunteer. So most of these shelters are ran but strictly by volunteers, and they have to have a certain number of volunteers to be able to open that night. So part of the determination is based on whether they have enough volunteers to staff the shelter on that night of whether they're able to open or not. So we'll talk a little bit about each one. So the Lower Bucks Code Blue is through Advocates for Homeless and Those in Need, AHTN. So they have a website and a Facebook page where they post their hours. They do rotate between churches throughout the Code Blue season. So they're not in one static spot the entire season. It is rotated usually by month. Central Bucks Code Blue is operated by the Coalition to Shelter and Support the Homeless, CSSH. They operate the same way as AHTN, where they go between various churches throughout the Code Blue season. And then the Upper Bucks Code Blue ran through Advocates for the Homeless of Upper Bucks, AHUB. They are open a little longer, so they're open in November through mid-April. And they also are in one static site for the entire Code Blue season. Street Medicine. So this is a new program that was launched in 2022. This is a program designed to work with households experiencing homelessness or domestic violence on the street, to work with them on their medical needs and any other health barriers that they may have. So they are mobile, so they travel throughout the county to work with individuals. They have a nurse on staff and a certified recovery specialist, case management. They do a lot of medical wound care connections with doctors and helping clients get prescriptions and health insurance, ongoing referrals, vaccine clinic support. So this was really launched to really, we've been seeing that there's more and more need for medical support at the street level. We have a lot more clients that are experiencing medical needs, and this is a really valuable service to be able to help clients where they are and be able to, connect them and prevent future hospital stays and trips to the ER is the goal. As far as eviction prevention goes, we're going to focus on the BEAR program for that piece. This is the Bucks Emergency Rental Assistance Program. So this is a program that is funded through COVID money through the federal government. So this is a time limited source. So at this point, this is the primary eviction prevention program through the Housing Link. So it is available to Bucks County renter households that have some sort of impact due to or during COVID and meet basic income eligibility through the program. We do at this point have a dedicated website and helpline for VERE specifically that is separate from the Housing Link. And the hours for the helpline are Monday through Friday, 9 a.m. to 6 p.m. At this time, there is a separate application and it can be accessed through the website link that's posted here. Housing location. So housing location is dedicated to households coming through the Housing Link system that are experiencing homelessness, either on the street or in emergency shelter. We do also partner with 2 other government organizations, CNY and Behavioral Health, that fund additional housing location for children and youth clients and behavioral health clients that may not be homeless, and those are coming through other funding sources. So for housing location, they are focused on, looking for and working with landlords to identify the most appropriate housing for clients seeking housing. It's been a struggle for housing location, specifically around the increase in the rents over the last year in Bucks County, which we'll talk a little bit more about. They do administer the Bucks Landlord Incentive Program, which was launched to kind of help to, target more landlords and increase the number of units in Bucks County that will rent to households experiencing homelessness through the Housing Link. The program contact is Kendra. She is the supervisor of housing location. One of the things that the housing locators, one of the tools is kind of housing choice vouchers through the Bucks County Housing Authority. We do try to use those as much as possible with clients experiencing homelessness for long-term housing stability, depending on their income and long-term ability to increase their income. One of the challenges that we're seeing is around the rental market lately, like that I just mentioned. We've seen since 2019 that the average rent in Bucks County has increased almost 15%. And another thing that's important to note around, the rent increases and utilization of vouchers is that, the voucher program is based on FMR rate, fair market rent rate, and that is based on the 40th percentile for rents in Bucks County. So right at the get-go, the vouchers are at a disadvantage because it's only targeting 40% of the rent. So only 40% of the units in theory would even be appropriate for a voucher based on the cost of the unit. So you can see for fiscal year 2023, the FMR just for an efficiency is 1,081, and that is an increase from fiscal year 2022. So it is a challenge to locate housing, even if a household does have a housing choice voucher because of the FMR rates and the current rent costs in Bucks County. Bonus for Bucks. So part of the Bucks Landlord Incentive Program is Bonus for Bucks. So this specifically is incentives for landlords and realtors who participate in the Housing Links program to, house program participants through the various programs within Housing Link. There's currently 3 incentives that are being offered through the program. So one is bonus rent, 2 is a finder's fee, and 3 is continuity coverage. So we are, utilizing these various incentives to hopefully increase the number of landlords that will rent to clients. And so far it has helped to increase that stock. So we are hoping to be able to continue this longer term. Now we're going to talk a little bit about the housing programs through the Housing Link. So these are for individuals and families that are experiencing homelessness or fleeing domestic violence. So we do have rapid rehousing programs. So these are focused on placing clients into housing with their own lease. So these are, they can stay in these units once the program ends because it is in their own name. And the program will provide rental assistance and case management support until they're able to maintain their housing on their own, whether through increasing income or obtaining a voucher. Transitional housing is for special populations, and it is utilizing master leasing. So the agency actually has the lease, and then the client completes a sublease with the agency. It's a little lower, it's a lower barrier model for higher need households. Sometimes the transitional can be the lease in the own name, but it is designed to work with more higher barrier households to provide more intensive case management and support to move them towards housing stability long-term. Permanent supportive housing is our highest intensive care program. It is focused on the highest need individuals, primarily households experiencing chronic homelessness, which is long-term homelessness combined with a disabling condition. We have very limited permanent supportive housing stock within Bucks County. At this point, we only have 17 units. So it is very limited, and we have to really target it and make sure we're serving the clients with the highest need at any given time when there is a program opening. It is indefinite, so it provides indefinite case management supports and rental assistance as long as the client needs it within the program. And that is the end of the presentation. I did want to just kind of highlight a little bit, what the volume looks like through the Housing Link system. In the last 12 months, the Housing Link helpline received 31,000 calls, which is a 29% increase from the previous year. So we're seeing the need continue to increase. And of those callers, 1,342 reported being literally homeless. So on the street, in a hotel paid for by a third party, or an emergency shelter, which is a 28% increase from the previous 12 months. So just when we talk about all of these programs, I just wanted to kind of point out what the volume is and the need is that we're seeing and how it is continuing to increase over the past year or so. So now we're going to shift and we can answer any questions that you may have. So feel free to go off mute, and if you have